Joseph. Hi, Joseph. Hi.
How are you?
Yeah, I'm good.
Hi.
I'm good. How are you?
Yeah, I'm fine, thank you.
Good. Listen, I know you're really busy, Joseph. I know that
Yes,
you're a very busy man. So I really
yes.
appreciate you taking the time to talk to me. We'll just be 5 minutes, but I wanted to talk to you about the pandemic in Kenya, specifically
Okay.
Magadi, and then specifically the areas that we know, like Picasso, where Memusi is. Um, I think it's really hard for us to imagine in the UK and in the Western world how life has been because we've not seen it on the news. We've not heard on the TV or on the radio about how life has been. You live there, Joseph. These
Yeah.
are your people. Can you talk to us a little bit about what life has been like in the last 18 months since the pandemic broke in Kenya? What's life been like?
Thank you so much, Matthew. And to be sincere to you, life has not been very easy here in Magadi. Life has been very difficult. First of all, this pandemic came in as a joke, and you very well understand that our level of understanding or really or in terms of education is still very low. First of all, sensitizing the people about the pandemic was a problem because people didn't understand why they should take precautions. People didn't know what to do. At the same time, when the pandemic came in, the government had required asked for people to do certain things like putting on masks, washing hands. And here is a poor community, which when you tell them to buy masks, you tell them to buy soap, tell them to buy some washing stations. On a priority basis, food and mask, then to them they'll go for food. So when the pandemic came in, we were negatively impacted, and the government was doing very little in terms of trying to mitigate the negative effects of the pandemic. First of all, when the pandemic came in, the government imposed some restrictions on movement. So it means people who are moving were restricted because of the lockdowns. And then, as well, because of that, tourists used to come to Kenya, and some people lost jobs. After losing those jobs, then the government came down because we are living in the border of Kenya and Tanzania. So the border was closed, and definitely and eventually the livestock markets were closed. That means people had no place to sell their livestock. That means small business people were closed down. So that had a negative impact because now those people who are absolutely dependent on the livestock lost their livelihoods. Those people who were depending on their small business and the marketplace had their business closed, and that ended up making people actually to starvation. So most people were not sure about the next meal. Now people are just living by the grace. They didn't know where to get their next meal, and that created a lot of problems because dependency rates went up. People are begging for food on the street. People are not sure about what to do next. So to be sincere and we also lost lives because we have no access to health insurance. So most of the people, and the government did not cushion people in any way. So we expected, like, if you get infected, you're supposed to go to the hospital on your own. And through that, some lives were lost, livelihoods were lost, because in some cases there are 1, 2, 3 cases which ended up in ICU, and this community cannot afford to pay for an ICU bed. So we ended up losing lives because there was nothing they could do. Because to them, going to the hospital and putting food on the table, is a priority to them.
Yes, and for the vast majority of a year, so throughout 2020, COVID. We didn't know of any COVID cases in Magadi specifically, but COVID did arrive in 2021, didn't it? I think it was wave 2 or wave 3 of the pandemic. It came to Magadi. What happened then? Because we know that it arrived because the company Tata paid for their staff to be tested, so we know it was there. What happened to the rest of the people?
Actually, to me, where I stand, you cannot isolate Magadi from Kenya because people from Magadi travel to other cities in Kenya.
Yeah.
So you cannot say that COVID came to Magadi in 2021. COVID came to Magadi the time it came to Kenya. What is happening was, you see, there was no free testing. There was no voluntary testing. So what happens is people have been suffering, but they have never been tested. So when now people starting going to hospital, a few staff were diagnosed to be having COVID, and that provoked the company, Tata Chemicals Magadi, to do mass testing for their employees in 2021. And that is why now the news, it was blown over that, yes, there is COVID in Magadi in 2020. But it has been there. People are living with COVID. Because looking at the science, it's only that testing was not done, but COVID has been here with the people. Even before Magadi, there are a few cases which were identified in the villages, people crossing over from Tanzania to Kenya. So we cannot absolutely say that COVID came in 2021. COVID has been here with us.
So I guess just to reiterate that point then, you obviously are very aware of the number of cases that have shown up statistically because people have been tested. So statistically we knew that it was in Magadi. However, what you're saying is the reality is it's always been there. And there were people dying and there were people becoming ill because of COVID, but not statistically because they couldn't afford a test. Is that what you're saying, isn't it?
The statistics you are getting from Magadi, where I stand is that they are more than what you're getting. The COVID numbers are more than that. Why I'm saying that is that the numbers you are getting are for members of staff of Tata Chemicals and their families. And a few community members who have gone to the hospital complaining of signs related to COVID. But this is just for the employees. So that tells you how big or how that thing has spread to the community. Because the numbers in the Tata Chemicals employees, I think, are like 1,000 people. So that's a sample of 1,000 employees. And this community, a population of this community is around 40,000 people. So when you have that numbers and the sample size is 1,000, and first of all, it's not representative because this ward or this community is so vast. You're only concentrating on the small township that surrounds Tata Chemicals. So to me, the numbers are much higher than the statistics should be much higher if testing was done around the community.
And I guess the same applies then right across Kenya. We've just talked about Magadi there. I've just looked on my phone and it says coronavirus cases Kenya 182,000. However, if that is only statistics based on the people who were tested, then the reality is it's been far greater than statistically we know about.
Yeah, exactly. The statistics should be much higher.
So how are things in Kenya now? Again, I'm just looking at the statistics now, and it looks like the cases are slightly going back up again. What's the perception right now of COVID? Are you scared of the new Delta variant, the variant that is seen in India? How are things and the perception of COVID now in Kenya?
First of all, after we had some regional lockdowns, and we expected the numbers to come down. Unfortunately, Kajiado was part of the counties which were locked down. And I tend to think there was much concentration on the 5 counties, and there was a neglect on the other counties. So when these counties' numbers started going down, then it was started coming up from the other counties. So we are worried for the fourth. There may be probably a fourth wave in Kenya, but we are hopeful because our expectation was after the third wave, then everything will normalize. But now the way things are now, we are worried about the new strains of COVID-19 which are coming up.
Yes.
Yeah.
Okay, I've got one final question, Joseph, and then I'll let you go. I wanted to reflect on the work that Memusi has done. You have been a key partner of mine for many years. You've been a key partner of mine working in Magadi. But over the last 18 months, we've done food aid, we've done work with soaps, we've done work with masks, we've supported every school with materials and the necessities to reopen school. And then we've done the work, because you also talked there about the livestock markets. And that's something that we have invested in through the livestock program to help keep people alive and not starving. Could you just reflect a little bit on how you've seen our work benefit Magadi in the last 18 months?
There is a saying that says that a friend in need is a friend indeed. As a community, we seriously acknowledge that Memusi Foundation is a friend indeed. When this government had opened the schools, they opened the schools without preparing our children for prevention of COVID-19. They had set protocols, but the government had not put place proper mechanisms to make sure that the kids complied. In this locality, the Memusi Foundation came in. They provided wash stations to all schools in Magadi. They provided masks for every child in Magadi, and they provided soaps to wash their hands. That, I can say, had a positive impact on our children, because after that, the school were reopened, and we didn't have much cases in schools. And if it was not for Memusi, then we don't know what the fate of our children could have been. So it's a great blessing. Secondly, when the market were closed, Memusi came in with a very brilliant idea of Smart Aid, where those starving families are given food on monthly basis, and through that, people were given the reason to live, because people had lost hope. Their hopes were renewed, because at least the very, very poor families, people who are living with HIV/AIDS, people who are on ARVs, people on TB treatment, at least could afford a meal, because you very well understand that when you are hungry, you cannot take those drugs. So at least lives were saved and hopes were renewed. At the same time, when the government imposed the closures on the markets, those people who are pastoralists, they only depend on their livestock. They had no place to sell their livestock, even those with the animals. So there was no place they could put food on the table. When Memusi Foundation came in and provided a market, an alternative market, where they could buy those livestock from the farmers at a considerable price, then it gives us hope, because there was a place we could actually sell those animals, get food on the table. You cannot afford to slaughter a goat every day, because that was the only hope that was remaining. But in the coming in of the Memusi Foundation, people were given the reason to live and the reason to hope for tomorrow. So it's a great thank you and a great appreciation to the Memusi Foundation for what they did, because even those people who were doing their own small businesses, there was nothing they could do. They were just sitting at home. So Memusi, first of all, provided food for them. Memusi provided masks for them. Memusi provided washing stations for them. So Memusi was everything to us. So we are very grateful. And where I can genuinely say as their leader that, yes, Memusi Foundation has remained a friend indeed for this community. And we really bless you for the good work they're doing for us.
Joseph, that's incredibly kind, and as long as we're given the strength and ability to keep helping, then we're there. Thank you, Joseph, for taking the time again. Really appreciated it. I did say 5 minutes. I think we've gone somewhat over. Thank you for taking the time. Thank you for bringing this to life a little bit more for people, because I'm sure people would massively appreciate listening to what you've said. God bless you all, Joseph. Please pass on our love to everyone in Percasse and Magadi.
Thank you so much.
Thank you once again, Joseph. Take care.
Thank you. Thank you.